What if the pill you take every single morning to protect your heart is quietly doing something to your body that your doctor never warned you about? Not because your doctor doesn't care, but because there are things about blood pressure medications, things about how they work inside an aging body, that most patients are simply never told. Millions of people over the age of 55 are taking Amlodipine, Losartan, or Lisinopril right now. They take it faithfully every day because they were told their blood pressure was too high and their heart needed protection. And yes, these medications do lower blood pressure. That part is real, but here's what most people don't realize. Lowering your blood pressure number on a machine is not the same as fixing what caused it to rise in the first place. And when the root cause keeps going, untouched, uncorrected, ignored, your body starts sending out warning signals. Signals most people brush off as just getting older: swollen ankles, a dry cough that never goes away, feeling dizzy the moment you stand up, muscle cramps that wake you in the night, fatigue so heavy it feels like you're moving through mud, brain fog that makes simple words hard to find. Sound familiar? If you or someone you love is on one of these medications, stay with me, because what I'm about to share changes everything. Most people believe high blood pressure is simply a plumbing problem. The pipes are too tight, so the water pressure goes up. Take a pill to relax the pipes. Problem solved. That's essentially what we've all been taught. And it's not wrong. It's just dangerously incomplete. Here's the real picture. High blood pressure isn't a disease. It is a symptom. It is your body's response to something deeper going on inside, something in your arteries, your kidneys, your hormones, your nervous system, or all of the above at the same time. When a doctor prescribes Amlodipine, Lisinopril, or Losartan, they are treating the number on the screen. They are not treating the fire that is still burning underneath. And here's what most people don't realize. When you take these medications long-term without addressing the hidden cause, your body can start adapting in ways that create new problems, new symptoms, new deficiencies, new risks. This is not the fault of the medication. These drugs save lives. They genuinely do. But there is a conversation most patients never have with their doctor, a conversation about what else needs to happen alongside the prescription. And that missing conversation is exactly what we are having today. Let's talk about what these three medications actually do, in plain, simple language. Because once you understand this, the rest of what I'm going to share will make complete sense. Amlodipine belongs to a class called calcium channel blockers. Think of your artery walls as muscles. When calcium enters those muscle cells, they contract and squeeze, which raises pressure. Amlodipine blocks calcium from getting in, so the muscles relax and the vessels open wider. Blood flows more freely. Pressure drops. The problem? Calcium is not just a villain in your arteries. Your body uses calcium everywhere. In your heart's rhythm, in your nerves, in muscle contraction throughout your entire body. When you broadly block calcium channels, there can be unintended effects. The most common? Swollen legs and ankles as fluid leaks into tissues. Fatigue. Sometimes a slower heart rate or even constipation in older adults. Now, Lisinopril works differently. It belongs to a group called ACE inhibitors. Your body makes a substance called angiotensin. Think of it as a pressure dial that turns up the volume on your arteries. Lisinopril blocks the enzyme that creates angiotensin so that pressure dial gets turned down. But here's where it gets interesting. That same enzyme, the one Lisinopril blocks, also helps break down a substance called bradykinin in your lungs and throat. When bradykinin builds up, it irritates the airways. The result? A dry, persistent, nagging cough that can drive people absolutely mad. Roughly 1 in 5 people on Lisinopril develops this cough, and most of them spend months thinking they've developed allergies or a respiratory problem. Losartan is related. It blocks a different part of the same system. Instead of stopping angiotensin from being made, it blocks the receptor that angiotensin attaches to. It's like changing the lock instead of taking away the key. Losartan tends to cause fewer coughs, but it brings its own concerns, particularly around kidney function and potassium levels, because when you block this hormonal system, your kidneys hold on to potassium. Too much potassium in your blood is not a minor inconvenience. It can affect your heart rhythm in ways that are serious. This is where the hidden damage begins, not from one big event, but from years of subtle shifts in electrolyte balance, fluid regulation, and vascular tone, quietly altering how your whole body functions. And after the age of 60, these shifts become much harder for your body to compensate for. Here is the part that most doctors simply do not have time to explain, and it matters enormously. When you were 35, your body had extraordinary backup systems. If one system got stressed, another would compensate. Your kidneys, your adrenal glands, your nervous system, your liver, they would quietly adjust, rebalance, and protect you. After the age of 60, those backup systems start to fade. And when a medication is subtly disrupting your body's fluid balance or mineral levels, there's less reserve to handle it. After 60, kidney function naturally declines, not dramatically, but measurably. Your kidneys filter your blood, manage your fluid levels, and regulate sodium and potassium. When you take Losartan or Lisinopril, you are directly affecting the hormonal system your kidneys use to do all of this. In younger kidneys with full capacity, this is manageable. In aging kidneys that are already working at reduced efficiency, this creates a real challenge. Then there is the autonomic nervous system, the part of your brain and nervous system that controls blood pressure automatically, like a background program running on your computer. After 60, this system becomes less precise. It reacts more slowly to position changes. This is why older adults on blood pressure medication are far more likely to get dizzy or even faint when standing up from a chair or getting out of bed. The medication drops the pressure, and the brain's automatic adjustment system is too slow to keep up. This condition has a name: orthostatic hypotension, and it is one of the leading causes of falls in adults over 65. Falls that break hips. Falls that can change a life in a single moment. Now add magnesium. After 60, many adults are already mildly deficient in magnesium. Amlodipine and other calcium channel blockers interact with magnesium metabolism in ways that can worsen this. Magnesium controls muscle relaxation, heart rhythm, nerve signaling, and sleep quality. When it drops, the symptoms are easy to misread: muscle cramps, poor sleep, heart palpitations, anxiety, constipation, and a general feeling of being unwell. And here's what surprises most people. These symptoms are frequently blamed on aging itself, on stress, on being run down, when in reality the body is trying to warn you that something deeper needs attention. Your body is never just complaining for no reason. Every symptom is a signal, and the signal is worth listening to. Let me tell you about a woman I'll call Margaret. She's 67 years old, a retired school teacher, active most of her life, gardened every weekend, walked her dog every morning. 5 years ago, her doctor told her blood pressure was too high, 158/94. She was started on Lisinopril. A year later, she developed that persistent dry cough. Her doctor switched her to Losartan. The cough went away. Her blood pressure numbers looked better. Everything seemed fine. But slowly, over the following 2 years, Margaret started to change. She stopped gardening as much because she was tired by mid-morning. She started avoiding evening walks because her legs felt heavy. She noticed her ankles puffing up by the end of the day. She started waking at 3 a.m. with cramps in her calves. She'd stand up from her armchair and have to grab the wall because the room spun. She went back to her doctor 3 separate times. Each time she was told her blood pressure was well controlled. Her test results looked normal. She was told to drink more water, to rest more, that these things happen as we get older. Margaret accepted that. Because when a doctor says it's normal, you believe them. What happened next surprises most people. A neighbor, a retired pharmacist, mentioned that many of Margaret's symptoms matched patterns he had seen in patients on long-term blood pressure medications. He suggested she ask her doctor about checking her magnesium level, her kidney function, and whether she was experiencing orthostatic blood pressure drops. She did. Her magnesium was borderline low. Her kidney filtration rate had dropped slightly over the past 2 years, and when her blood pressure was checked sitting versus standing, there was a significant drop within seconds of standing, the exact pattern that was causing her dizziness. Her medication was adjusted. She made specific changes to her diet. She added a few simple daily habits, and within 8 weeks, she told her doctor she felt more like herself than she had in years. Margaret's story is not unusual. It is far more common than most people know. The difference is that she finally got the right conversation. Here's something you can check right now. Sit quietly in a chair for 5 minutes. Take your blood pressure if you have a home monitor. Write down the number. Now, stand up slowly. Wait 30 seconds. Take your blood pressure again while standing. In a healthy cardiovascular system, the numbers should stay close, or the standing reading should actually rise very slightly as your body compensates. But if your systolic, that's the top number, drops by 20 points or more within 1 to 3 minutes of standing, that is a meaningful sign. It suggests your blood pressure regulation system is struggling to keep up with simple position changes. This is not a diagnosis. And please, do not stop your medication based on this test. But this is useful information to bring to your doctor. It is a conversation starter, a data point that might explain symptoms you've been ignoring or accepting as normal. There are other signs worth paying attention to. Waking between 2 a.m. and 4 a.m. with leg cramps or restlessness can point to magnesium imbalance or disrupted vascular tone. Pressing firmly on your lower shin or ankle and noticing that the skin stays dented for more than a few seconds, that visible indentation is called pitting edema, and it suggests fluid is pooling in your tissues, a common side effect of calcium channel blockers like Amlodipine. And if you've had a dry cough for months that appears every time you lie down or talk for long periods, and you're on Lisinopril, there is a very real chance the medication is the cause. That cough is not a coincidence. It is your body sending a message. Now, what can you actually do? Not instead of your medication, but alongside it. Because the most powerful thing you can do is support the systems that your medication is working with. The first and most important habit is what I call the slow rise practice. Every single time you move from lying to sitting or from sitting to standing, pause. Do not rush. Sit on the edge of your bed for 30 seconds before standing. When you stand from a chair, hold the armrest and take a breath before walking. This single habit reduces your fall risk significantly. It gives your nervous system time to adjust blood flow before you're upright and moving. It sounds almost too simple, but for someone whose blood pressure drops when they stand, those 30 seconds are genuinely protective. Second, magnesium-rich foods deserve a place in your daily meals. Dark leafy greens like spinach and Swiss chard, pumpkin seeds, almonds, black beans, and avocado are all excellent sources. If your diet doesn't regularly include these foods, talk to your doctor about whether a gentle magnesium supplement, particularly magnesium glycinate, which is easy on digestion, might be appropriate for you. Third, hydration is not just about drinking water. People on blood pressure medications need to be particularly thoughtful about sodium and fluid balance. Not severely restricting salt, that can actually backfire in some people, but getting it from natural whole food sources rather than processed packaged foods. The sodium in a fresh tomato behaves very differently in your body than the sodium in a can of soup. Fourth, gentle, consistent movement is one of the most powerful tools you have. Not intense exercise. Not hours at the gym. Simply walking 20 to 30 minutes a day at a comfortable pace has been shown in numerous studies to support blood pressure, improve vascular tone, enhance kidney circulation, and help regulate the nervous system's blood pressure response. The key word is consistent. Every day, even when you don't feel like it. Especially when you don't feel like it. Fifth, sleep position and timing matter more than people realize. If you experience ankle swelling from amlodipine, elevating your legs slightly while you sleep, a folded pillow under the calves, helps drain pooled fluid overnight. Also, if you take your blood pressure medication at night rather than in the morning, some research suggests it may provide better overnight protection and slightly reduce morning dizziness. But do not change your medication timing without talking to your doctor first. This is a conversation worth having. Sixth, manage the stress response in your body. Chronic stress keeps your sympathetic nervous system, the fight-or-flight system, activated. That raises cortisol. Cortisol raises blood pressure. It is a cycle that medication alone cannot fully break. Slow, deliberate diaphragmatic breathing, where your belly rises and falls rather than your chest, activates the opposite system, the parasympathetic nervous system, and genuinely lowers blood pressure in real time. 5 minutes of slow belly breathing in the morning and 5 minutes before bed is not a wellness cliche. It is physiology in action. And finally, foods that naturally support the vascular system deserve mention. Beets and beet juice contain nitrates that the body converts to nitric oxide, which relaxes artery walls. Berries, especially blueberries and pomegranate, contain compounds that support endothelial function, which is the health of the cells lining your blood vessels. Garlic has been studied extensively for its blood pressure supporting properties. None of these are magic. None replace your medication. But together, they create an environment in your body where your medication can work more effectively and where your body needs less help managing blood pressure over time. One of the most important things I can tell you is this: your body responds faster than you expect. Not in days, sometimes, but in weeks, consistently. And the people who stay the course see changes that feel genuinely remarkable to them. In the first 3 to 5 days of consistent slow-rise practice, better hydration, and magnesium-supportive foods, many people notice that the morning dizziness becomes less severe. The legs feel slightly less heavy by evening. Sleep quality often begins to improve modestly. These are small wins. Notice them. They matter. By the end of 2 weeks, leg cramping at night frequently reduces for people who have addressed their magnesium and potassium balance through food. Energy levels in the morning start to feel steadier. If you've been doing the walking, your heart rate at rest may already be very slightly lower, a sign that your cardiovascular system is adapting. At the 4 to 6 week mark, something more meaningful begins to happen. Many people who make consistent daily changes start to see their blood pressure readings at home becoming more stable. Fewer spikes in the morning, less variability through the day. This is your vascular system and nervous system beginning to work together more smoothly. Some people find that their next doctor's appointment brings a conversation about possibly reducing medication doses. That doesn't happen for everyone, and it should never be attempted alone, but it becomes a possibility worth discussing. At the 3-month mark, for those who have stayed consistent, the overall picture often looks very different. Less fatigue, better sleep, more stable energy, a calmer nervous system, and often a renewed sense of agency over their own health. Not just taking a pill and hoping for the best, but actively participating in their own recovery. Before we reach the end of this conversation, there are things I need to say clearly because they matter for your safety. Do not stop taking your blood pressure medication. Do not reduce your dose. Do not change when you take it or skip doses without your doctor's direct guidance. These medications prevent strokes. They protect kidneys. They reduce the risk of heart attacks. They are prescribed for serious, life-altering reasons. Nothing in this video overrides that. If you experience sudden severe dizziness, chest pain, significant swelling, difficulty breathing, a very rapid or irregular heartbeat, or a blood pressure reading that is dramatically higher or lower than your usual range, that is a medical emergency. Contact your doctor or emergency services immediately. Do not wait. If you have been experiencing unexplained fatigue, chronic leg cramps, worsening ankle swelling, a persistent cough, or morning dizziness for weeks or months, please bring these symptoms to your doctor's attention. Ask specifically whether your magnesium and potassium levels have been checked recently. Ask whether your standing blood pressure has ever been measured. Ask whether your kidney function has been reviewed in the context of your medication. These are excellent medical questions, and any good doctor will appreciate that you are paying attention. You are not your blood pressure number. You are a whole person, and you deserve to be treated that way. Here is the truth that I want you to carry with you after this video ends. Your body is extraordinary. Even at 65, even at 70, even if it has been through decades of stress, poor sleep, difficult seasons of life, and years of managing a chronic condition, your body still wants to heal. It still responds. It still adapts when given the right support. High blood pressure is not a life sentence of worsening symptoms and escalating medications. For many people, it is a signal, a message from a body that has been under strain for too long without the right kind of care. The medications you are taking are doing important work, but they were never designed to do the whole job alone. They were designed to manage a number while you, and your doctor, work on the conditions that cause that number to rise. When you slow down before you stand up, when you add a handful of pumpkin seeds to your breakfast, when you walk for 25 minutes even on the days your legs feel heavy, when you breathe slowly and deliberately for 5 minutes before bed, when you bring your symptoms to your doctor and ask the specific questions that matter, you are not doing small things. You are participating in your own recovery in the most meaningful way possible. The people who feel the biggest improvements are almost never the ones who made the most dramatic changes overnight. They are the ones who made small, consistent, intelligent choices, day after day after day. And one morning they looked up and realized they felt different. They felt like themselves again, not just managed, not just surviving, but genuinely, quietly, well. That is possible for you. Your body has not given up, and neither should you. If this video gave you something useful, a question to ask, a sign to look for, a habit to try, please share it with someone who is also on this journey. Because this conversation is one that far too few people are having, and it is long overdue. Take care of yourself. You are worth every effort.